Much has happened in the last several years to change the landscape of how people living with mental health conditions access quality mental health care. The goal of this webinar is to help you develop a better understanding of how to maximize your health insurance benefits through the changes in the laws that govern your health insurance policy. In particular, we will focus on mental health parity rules, the rules that mandate that insurance plans provide the same level of benefits for mental health coverage as they do for medical and surgical coverage. Before we begin the workshop, let me take a few moments to introduce you to the Depression and Bipolar Support Alliance. DBSA is the leading peer-led organization for individuals living with a mood disorder. As a patient advocacy organization, all of our programs are informed by people with lived experience. By charter, 51% of our board of directors and paid professional staff must identify with a diagnosis of a mood disorder. We offer leading-edge interactive online resources to inform, empower, support, and inspire individuals to achieve the lives they want to lead. We accomplish this by providing up-to-date, scientifically based tools and information presented in easily understandable language to empower individuals to make informed decisions and be the creators and drivers of their own treatment plans. We actively participate in research as we seek treatment solutions that target the whole health of the individual. We will be talking about policy and laws today, but I am not an attorney. This workshop is for informational purposes only. Please contact an attorney if you need legal assistance. At this time, I invite you to take a quiz to learn for yourself how much you already know about parity. As I read through these, please indicate whether you think a statement is true or false. The government is responsible for catching parity violations when they happen. An insurance plan is allowed to set high copays for behavioral health medications. An insurance plan is allowed to have a separate deductible for mental health. The first step in filing an appeal is to file a complaint with the federal government. Parity means people have equal benefits for physical and mental health. We'll come back to this quiz at the end of the webinar and review the answers. Americans can obtain health insurance through a variety of sources, mostly determined by their employment status. The passage of the Affordable Care Act, or ACA, provided insurance opportunities to many previously uninsured Americans. One way to obtain coverage is through an employer. These are sometimes called group health insurance plans, which refers to a number of individuals and their families covered under a single health insurance contract, usually a group of employees. Another way is healthcare marketplace exchanges. Individuals and families who are not eligible for group health insurance may purchase insurance in the open marketplace, also known as an exchange. Some states run their own insurance marketplace. For those states that don't offer a marketplace exchange, the federal government has provided this platform. Lastly, there are federal government programs including Medicaid, Medicaid Expansion, the Child Health Insurance Program, or CHIP, Medicare, Federal Employees Plan, and TRICARE or military. Medicaid expansion came about as a result of the Affordable Care Act. States were given the option to expand their Medicaid program to adults whose income is at or below 135% of the federal poverty level. To date, over 30 states have chosen to expand their Medicaid programs. Let's review some insurance terminology. I'll read off the slide for this, and you can let me know if you think it's true or false. The deductible is the amount of money you pay before your insurance company will start paying money for a claim. That's true. Coinsurance is a percentage you pay for a claim. That's also true. A copay is a fixed dollar amount you pay for a claim, as opposed to coinsurance, which is a percentage of the claim. A copay would be like if you were to go to your doctor and pay $20 regardless of how much the doctor cost. That one's true. In-network providers are doctors and hospitals that are part of your insurance network. Obviously, that one is true. The purpose of this webinar is to share with you how you can use your existing health insurance benefits to increase your access to care through the mental health parity laws. Mandates of the current parity law went into effect in 2010, yet many people are still unaware of the rights they have to mental health care just by using their existing health insurance plans. The law applies to most health plans that offer mental health coverage. Unfortunately, many plans found that the way around this was to just not offer mental health coverage in their insurance plan. The Affordable Care Act, which went into effect in 2014, strengthened the parity law by requiring plans to provide mental health benefits, otherwise known as essential health benefits. The ACA requires group insurance plans for employers with over 50 employees, the Federal Employees Health Benefits Program, the state children's health insurance programs, and some state and local health plans, and many plans purchased through the health insurance marketplaces to both provide mental health benefits and abide by the mental health parity rules. The term parity means equal to. The parity law is fundamentally grounded in ensuring equal access to treatment services under both mental health and medical benefits offered by a plan. Thus, the parity law requires that plans, policies, and practices to cover mental health services cannot be more restrictive than the policies and practices for medical and surgical services. Our mental health must be treated the same way as our physical health. It must be apples to apples. For example, if you can see a cardiologist, which is a specialist, 12 times a year, then you can see a psychiatrist 12 times a year. If your out-of-pocket expense to see that cardiologist is $50 per visit, then your out-of-pocket to see your psychiatrist is $50. If your plan allows you to go outside of your geographic region to obtain medical, surgical benefits for whatever reason, then it must offer the same benefit to obtain mental health care outside your geographic region. A little later on, we'll also discuss what constitutes a parity issue. The law and regulations provide ways to challenge a decision that you think is keeping you from receiving benefits you are owed. People living with mood disorders have often found their insurance coverage inequitable when compared to their medical and surgical benefits offered in their health insurance plans. Many plans placed much higher financial obligations and set higher bars for defining when care was necessary than they did for other medical conditions. If a plan is required to follow the parity rules, you can expect equal coverage when it comes to treatment limits and payment amounts with respect to coverage such as out-of-patient, in-network, and out-of-network, inpatient treatment, in-network and out-of-network, intensive outpatient services, partial hospitalization, residential treatment, prescription drugs, and emergency care. And each of these is required to follow the same parameters with regard to copays, deductibles, maximum out-of-pocket limits, geographic location limitations, facility types, and the amount they provide for provider reimbursement. The parity law increases access to care because insurance plans can no longer have a different set of criteria for physical health benefits than they do for mental health benefits. This is important when looking at medical necessity. The rules for medical necessity must be consistent. The parity law requires that our mental health and physical health coverage benefits be comparable. Remember, apples to apples. Lastly, the law says that the plan must disclose to us and our providers the criteria used to make a decision regarding coverage. You have access to the rules around medical necessity today. I encourage you not to wait until you need the benefits to find out what the rules are for medical necessity. There are several reasons for this. If you know what the rules are now, before you need them, then you and your doctor will be in a position to comply with the rules of the plan. You will have a game plan in place before you need the benefits. This is more difficult when you are in a crisis and are not in the best position to begin understanding the rules about how to apply them to your own immediate situation. By law, insurance plans must provide this information to you within 30 days of asking. So please ask for them today. This doesn't mean that plans can't have limits. They can, but those limits have to be comparable, apples to apples. Let's look at an example. Brooks lives with a pulmonary disorder. He went to the doctor and was diagnosed with pneumonia. Because of his medical history, his doctor believes he should be hospitalized so that Brooks has the best chance of attaining wellness. This should also mean that if Brooks experiences a bipolar disorder episode that is not responding well to his current treatment protocol and his doctor recommends hospitalization, his plan should include this benefit. However, the plan requires a pre-authorization that the care be delivered using in-network providers and facilities. That means the plan can set limits on his insurance benefits, whether that is for medical, surgical, or mental health. The point is, the mental health requirements cannot be more restrictive than the medical, surgical requirements. We must know what our medical and surgical health benefits are in order to know if our mental health benefits match those. The term medical necessity doesn't have a single definition. Because of this, it can sometimes be a confusing thing to understand when dealing with insurance plans. For the sake of this presentation, and to make sure you understand how the parity law applies here, we're going to keep it really simple. Think of medical necessity as a set of rules an insurance plan will use to decide whether they'll cover a service or treatment. Each plan can have its own set of rules. However, they must consider the following when deciding whether or not to cover a specific treatment or service. Is it reasonable? Is it necessary and or appropriate? Is it based on evidence-based clinical practice and standards of care? In the past, insurance plans were the only ones who knew what the rules they were using were. They could deny treatment by simply saying, quote, did not meet the criteria for medical necessity, unquote. However, now thanks to the parity law, we can get some answers. One of the critical pieces of the law are the rules governing disclosure and transparency. As I mentioned, in the past, an insurance company could deny paying for treatment without letting an individual or their provider know why. Today, this information must be made available to anyone looking to purchase an insurance plan or any current member of the plan and to their contracted providers. That means you have the right to ask for this information before you subscribe. The law also says this information must be disclosed and must be provided within 30 days of the request. To avoid any surprises when you or a loved one is in crisis, take the time now to proactively ask for this information. In the resources slide, there is a link to a letter from the Kennedy Forum that makes it easy for you to do this. The letter is already written. All you need to do is insert your personal information. To help you better understand parity, let's review a few scenarios. Susan lives with bipolar disorder. She has a cardiovascular disease. It's been a rough year for Susan. In March, she had a mild stroke and has been receiving rehabilitative care to assist her in strengthening the muscles in her left arm and hand. She's been seeing a physical therapist once a week. Her insurance plan places a limit of 26 visits per year for physical therapy. While the stroke has been a setback, Susan continues with her Wellness Recovery Action Plan that includes seeing her therapist once a month and her psychiatrist 4 times a year. Today, Susan is shocked to receive a letter stating that she had exhausted her psychiatric benefits. She admits that she's been seeing her therapist more often since her stroke, but nevertheless, when she looked at her calendar, she noticed that she had only been to her therapist 12 times this year. Is this a potential parity violation? This is a potential parity issue. How many visits did they allow to the physical therapist? 26. How many visits did she have to her therapist? Only 12. Remember, the plan can have limits, but those limits have to be comparable. 26 physical therapist benefits equals 26 visits to her therapist. Catherine lives in Chicago, Illinois, and is covered under her employer's group insurance plan. Catherine has been dealing with her symptoms of depression. She's been working with her doctor and her therapist, and they all agreed she should take some time off of work and participate in an outpatient treatment program like a partial hospitalization program, or PHP. Catherine has found a treatment program that she likes at the Mayo Clinic in Rochester, Minnesota, which is one of the top facilities in the country for her condition. Catherine has been seeing her therapist in Milwaukee, Wisconsin, and her insurance has covered these visits without question. There are other treatment options in her area, but she doesn't like them as much as the Mayo Clinic. Her father, who works for the same company and has the same insurance plan, has been going to the Mayo Clinic for cancer treatments. Her insurance company has notified Catherine that her request to pay for services at the Mayo Clinic has been denied because the service is out of state and she needs to find a program in her local area. Is this a potential parity issue? This is a potential parity issue. Since the insurance plan approved one outpatient treatment in another state, Wisconsin, they would also be required to approve other outpatient treatments, such as the Mayo Clinic in Minnesota. Also, since they approved medical treatment at the Mayo Clinic for her father, it could be argued that they would need to offer the same geographic coverage for her mental health care. A side note is this only applies because they have the same health insurance plan. Your plan is only required to match itself, not your neighbors or any friends or family. So this example only works for that reason. Jamal lives with bipolar disorder and is covered by his mom's insurance. Jamal takes several generics and brand name medication to treat bipolar disorder. When Jamal returned to college in September and picked up his refill for his prescription, he called his mom and told her the prescription, which used to cost $30, now costs $100. Is this a potential parity violation? This is not a potential parity violation. The Affordable Care Act and the mental health parity rules do not prohibit changes in prescription coverage. Insurance companies have the ability to change their formulary, which is basically a plan of what medications they will cover at what cost. The rules do not restrict the dollar amount insurance plans are able to set for medications. While the parity law is a federal law, a key point of entry is the state's insurance departments or commissions to implement and enforce the law for most types of insurance plans. The Federal Department of Labor oversees large self-funded insurance plans. If you believe that your plan is not complying with the parity laws, you have the right to appeal, and you should. First, it's important to get all of your information together. Keep a log of your appointments, what happened and when. If you do not have that information when you want to file an appeal, create it based on your best memory as soon as possible. Also, keep a log of all conversations and letters with your insurance company. Make sure you keep all of this information together. Request the following information from your insurance plan: a description of non-quantitative treatment limitations. Quantitative treatment limitations are things that can be measured, like a number of visits. Non-quantitative limitations are things that cannot be measured directly. The criteria for determining medical necessity, the reasons for denying the claim, any new evidence used to determine the benefit decision. Something may have changed since the last time they covered your treatment, and that's why they're denying the claim. And copies of all documents and records. These are free of charge. And this is so that you'll have the data you need in case you have to file with the federal or with your state insurance policy. If someone tells you something, write it down and log the date and the time and who said it from your best memory. This helps everyone in the future. Your healthcare provider can be a great resource in the appeal process, as they can help address standard practices and document medical necessity. They can also contact your insurance company on your behalf and request additional information. To file an appeal, it's best to start this process verbally with a call. Be sure to log the conversation along with the employee's name and an overview of what was said. Make sure to clearly, as best you can, explain the violation. This may work in your favor immediately. If not, then find out where to send your written appeal. Write a letter to appeal your case. Your provider may be able to help you with this as well. Make sure to include the following in your letter: your plan information, numbers and identifiers, facts about the denial, and explain why you believe this is a parity violation. Remember, this is a process and it will probably take time. So let me use Susan as an example for how to do a verbal appeal. Hi, my name is Susan Smith, and I'm a little confused because I received a letter stating I had exhausted my outpatient mental health benefits. But when I looked at my treatment log, I'd only used 12 visits for the year. I think there's been a mistake because I know that according to the parity law, I'm entitled to the same number of visits for mental health as I am for my medical surgical, and I'm allowed 26 visits for physical therapy. How can I get this corrected? Again, a call like that one could resolve your issue. If not, then you'll need to file a written appeal. If after filing an appeal with the insurance company, your claim is still denied, ask if there is an outside review process and what that process is. Follow their procedure and make sure to include your full name and plan information in all communications. It is a best practice to also include a brief statement on the issue in your communication so it can be easily identified in case there are multiple issues with your plan and insurance company. If you are still denied or there is no external appeal process, file a complaint with your state insurance commission. File a complaint with your state attorney general, and file a complaint with the federal government or ERISA at the Department of Labor. And finally, if needed, find a lawyer for legal representation. Listed here are a number of key resources to help you understand health insurance parity laws and compliance. As I mentioned earlier, the Kennedy Forum, which is the second resource from the top listed here, is the one that has the letter templates. The letters are already written. You just fill in your personal information. Now we're going to take a look at the 5 questions we asked at the beginning of the presentation. The government is responsible for catching parity violations when they happen. False. The government is responsible for enforcing the rules. They can't enforce what they don't know. That's why each of us plays a critical role in bringing attention to violations. We are responsible for catching the violations. An insurance plan is allowed to set high copays for psychiatric medications. That's true. The Affordable Care Act and the Mental Health Parity rules do not limit the amount of insurance plans can set for copays when it comes to medications. An insurance plan is allowed to have separate deductible for mental health. That's false. The rules do require that there be no separate deductibles. If they can have one for mental health and medical health, and once it's met, then your deductible is met. The first step in filing an appeal is to file a complaint with the federal government. That's false. The first step in filing an appeal is to collect all the relevant information. This includes gathering general information and requesting information from your insurance plan. Follow the steps outlined in your How to File an Appeal fact sheet. Parity means people have equal benefits for physical and mental health. That's true. This is exactly the goal of the Affordable Care Act and the Mental Health Parity Rules. Physical and mental health must be treated equally, apples to apples. Finally, one of the best ways to make sure we get access to mental health care and ensure the Affordable Care Act and the Mental Health Parity Rules are followed is to join forces. A single voice may be easy to ignore, but a group of combined voices cannot be ignored. Please help support others by contributing your voice. Please complete the subscriber form for our mailing list so that we can make a difference and keep you informed and let you know when your voice is needed. Also, regulatory and judicial leaders in your state are interested in hearing about parity challenges. You can make a real contribution to changing policy in your state and ensuring access to care by doing these two things. You can go to www.dbsalliance.org/takeaction and click on subscribe. And at that same link, you can also click on share your story in order to let us know if you've experienced a parity violation. Thank you for your time.